So we're here with Alex McKinven, who is a physio who works in performing arts. So we'll get a little bit of an introduction and an origin story of where Alex came from and how he got into the role that he does today.
Well, thank you for having me on your podcast. So as you said, my name's Alex McKinven. I'm working full-time in performing arts in London's West End. I suppose from an origin story, I come from a performing background. So as a kid, I went to theatre school, trained in dancing, singing and acting. I was always really interested in the human body and how it worked. So when I was in year 10, we had an osteopath come to the school and do a sort of a workshop on, I suppose, injury prevention. This in the 80s, because I'm that old. And it really sparked my interest. I thought there could be something here that, I could look at with my performing arts career and sort of doing. So, as I went and did my A-levels, I actually then got into university in Hertfordshire. So I went to the University of Hertfordshire and did my physio degree there. That was in the 90s. And then I found an organisation called IADMS, which is the International Association of Dance Medicine and Science. So that was sort of a niche area that was starting to develop. And it was always keen looking at what was out there and what was provided for dancers. And it was probably the start of looking at how sports medicine concepts could be applied in the theatre world. So I did my rotations, did my sort of senior twos. At that time I was still performing as well, so I was doing like a dual career. But I got to that stage where the physio sort of was taking over a little bit more, was getting sort of better jobs. Went and did my master's in advanced physio at King's, and after I did that, some big jobs opened up in some of the ballet schools and with some of the big dance companies. At the same time, with IADMS, I started to progress with that organisation. So the last few years, I've been their programme chair. So I've been sort of putting the concept and the presenters together for their big conferences. And what we're using is the same model, similar to with the ACPSEM, about how can we sort of expand the research and the understanding of what injuries performers have and how we can develop that, so applying the sports science principles into dance. And say recently, so post-pandemic, as things are opening back up, working primarily, say with some of the big West End shows, and applying those sort of principles to improve health and wellness in my population.
Brilliant.
So you touched on kind of doing rotations initially. That sort of first job where you get one in performance arts, how does that process come about? So you've obviously done your MSc, and then you've said that sort of opportunities really opened up, but in terms of applying for a job, how does that differ to maybe applying for a rotational job within the NHS?
So I suppose I'm a little bit more old school. I think that the way I was taught, you learn so much in your sort of undergraduate programme that it's really good to consolidate it. So when I did my rotations, I went through neurology, respiratory, as well as orthopaedics and MSK. And obviously I always knew that I was more interested in the MSK side of it, but I could see the benefit of learning those skills and consolidate it, because at school it is such a jam-packed sort of process. And those skills that you get as a general physiotherapist really help you, what I found in my career. Say, for example, recently, before COVID, I was having people coming to me with respiratory problems. Obviously, this was pre-pandemic, so I didn't know what was going on, but I was still using those skills that I'd picked up with my auscultation and sort of breathing exercises. And we know that within performers, the voice, the breath is really important. So I still go back to all of those skills that I learned in terms of my respiratory physiotherapy and apply them in my practice these days. So I was a great believer, and I wanted to just consolidate my sort of undergrad sort of education. And I think as well, as you get older, you get generally more gravitas just with age and maturity, so you learn different skills through life, which then obviously do help you. So I think within the field, because I've been a physio for 26 years, you have that experience, which does take time. You can't get that sort of instantly. And the nice thing is then applying that into sort of the dance medicine field. So I think a lot of people ask me, how do you get into to those sort of jobs? I think it's making connections. So social media is great for that. Who are the people who are in positions of sort of authority at the moment? Can you spend some time shadowing them, seeing what they're doing? From my perspective at the moment, I'm really interested in the research side of it, so looking at doing my PhD or a professional doctorate in that area. So how can we get the evidence to support what we're doing in terms of practice? But I think it's not just the skills that you learn in school per se. It's those softer skills, your communication skills, your professionalism. That sort of stands you apart and helps you get into the roles that you want as well. Within dance medicine, there's two sort of schools of thought. Does it help having a background in dance? So as a performer, if you've been a performer, do you understand the dancers better? Or if you've been through the training, can it sometimes bias your decisions because you've grown up in that world as well? So there are two schools of thought. So sometimes in dance medicine we get people coming in who haven't got any dance medicine experience, and they bring a lot to the table as well. So I think it's trying to get that balance. You don't have to be just a dancer to work in performing arts. It does help obviously to have an understanding and also a passion. I did a placement in rugby. Not a rugby fan per se, but I wanted to learn the skills. What could I take from what was happening in the sort of rugby world and apply that within sort of my own practice as well? So I think every experience is useful and beneficial. One thing we're looking at within international sports physiotherapists is these competencies, and what we want to make sure is that people look at what they're doing and have a structured CPD plan. And the ACPSEM is really keen on providing quality education and developing students with the right sort of competencies, so when they get into the roles they have the skills to be able to do the job and are mentored and supported to progress up the career ladder safely.
So I suppose almost the obvious question is what actually is dance medicine, and how does that differ from sports medicine, say?
Or is it the same?
Fun enough, we had a duel at one of our Adams sort of meetings where we were looking at the differences between sports science and dance science, or sports medicine and dance medicine. Dance medicine is looking at the health and well-being of performers, but also more recently looking at what dance can do to help society, so with other sort of medical disorders. So I suppose it's like that exercise is medicine, role dance as well. How can that help with conditions? So it's a broad remit. Yes, you've got the one part of it which is people working with performers, looking at performance optimization. So looking at all your screening, profiling, your injury prevention or risk reduction strategies, trying to teach them about health and wellness behaviours, and educating all those around the community. So it's not just the dancers, it's the parents if they're youngsters and they're in some of the academy systems, or looking at choreographers and teachers and artistic directors, and trying to have open discussions with them about how we can improve the services. So looking at that sports science model, extrapolating some of the data, but also trying to get funding to look at the specific genre. And obviously dance is talk about dance medicine, there's so many different styles of dancing. I've been lucky, last year I was on tour with river dance. Really interesting to look at the percussive styles of dance, tap dancing, flamenco, Irish dance. What sort of injuries do they have? We've got break dancing coming into the Olympics, so we're looking at programs. Do people, say for example you were a physiotherapist who was in charge of the physiotherapy provision for break dancers, what sort of injuries do break dancers get? How would you react if there was an injury with a break dancer at the Olympics? How do you rehab that person? do people know that? So what my sort of role is to try and develop those sort of those competencies or that awareness and start to implement that as well. So the whole point of looking at dance medicine, the different genres of dance, and trying to build the research base within that community and develop the speciality.
And then I know you've touched on a lot of the things that you're currently doing, and you're quite advanced in your career now, and you're almost looking at how can you look forward to the future and how can we set these competencies. But if you scale it back a few years when you were just not a band five, but you're going into the profession as a performance physio, what did a normal day look like? What is a day-to-day jobs? What does the day-to-day look like for you?
So I suppose I've been really lucky in some of the jobs that I did early on, that I had really good mentorship, and I think that to me was key, that there was somebody that I could turn to face and ask questions to and discuss things with. I think nowadays obviously people use social media a lot more to have those open discussions, but for me, just having that leadership role and that mentor in the same clinic that I could ask about patients, they could observe what I was doing and help me progress with my sort of handling and manual therapy skills, but also look at my communication skills, because we know communication is a really important part of our job. Even with the conference today, looking at the wider perspective as well, sort of health and well-being, and how that is so important in injuries per se, as well as optimal performance. But a day to day, I suppose from a theatre point of view, things start a little bit later. So normally, if you're in the theatre, you'd be called in, earliest about 10:30 in the morning, especially if there's a matinee show. In that time, people would come and see you if they needed exercises or any sort of manual therapy treatment to help them get through the show, any sort of strap-in taping. During the show, you're on standby in case there's any sort of emergencies as well. And then you might also see people who aren't currently performing, whether it be through injury or if they're a swing in the show, so people would come and see you while the show's on, so people on standby. I suppose on the bench would be another way of thinking about it. Obviously you can see people if during the interval, if anything happens during the show. Same thing for sort of Act 2. And then if it's a double show day, treating people in between the shows. And then obviously making sure everything's completed by the end of the day. If anything's happened during the show, sorting that all out, and then wrapping it up before heading home. Sometimes it's important to apply those sort of sports science recovery methods as well. So we're trying to make sure dancers don't just jump on the train and get home as quickly as possible, which is difficult because obviously everybody's tired, people are hungry, but what can we do to help with their recovery? Because if you think about most West End shows, they're performing 8 shows a week, so it's pretty demanding. And we know there's lots of demands on performers at the moment in terms of the COVID situation. So people are worked quite hard, and we're trying to look at their training and their workload and see how we can balance that out to make sure we're dealing with healthy performers. So that sort of sums up my sort of daily sort of role.
Yeah. Thank you very much for giving us insight into dance physio and the area of performing arts. Cool. Okay, switch this off.